Hello and welcome to another Q&A. I really appreciate you being here and taking the time to watch these. I do hope that you have seen my other ones that I've been doing, so please check me out on my social media pages or on YouTube. They're all up there. I'm really enjoying doing these and meeting these amazing women and just learning from them. So this one, we're talking pre and postnatal. So this is for all you mamas out there. If you're newly pregnant, heavily pregnant, or just had a baby, I know you're going to get a lot out of this one. So today I have Sarah Paxford. Sarah is a Pilates instructor and occupational therapist down at Wellbeing down in Currumbin. And she's also a lymphedema therapist as well. So if you're not sure what that is, we'll touch on it later, but think leg swelling. So hello, Sarah, and thank you so much for doing this with me today.
Hey, Alison, that's all right. Thanks for having me.
All right. So if you could just start by telling us a little bit about yourself, what you do, and how you got into the work that you do.
Okay, so like you said, my name's Sarah. I own and run Recover Wellbeing, which is a Pilates and holistic health studio in Currumbin. Mm-hmm. I originally worked in a hospital up until 3 years ago, so as an occupational therapist, and I was just doing Pilates on the side. I've been doing Pilates for about 7 years, and yeah, the hospital was a really good job. It was really amazing and rewarding, but in the same sense, I feel like I'm a lot more holistic in my approach, and at the end of the day, like, the hospital is quite a draining place to work, and it has a lot of limitations with what you can do and the services that you can provide. And I wanted to be able to work with women in a little bit more of a broad scope, and especially with the work that I do with lymphedema. So I opened up my own Pilates and holistic health studio, and now I just absolutely love it. Would not change it for the world. And I get to work with women every day. Our clientele is sort of probably about 95% female. Mm-hmm. So we do a lot of work with pre and postnatal Pilates. I see a lot of women through pregnancy with their issues with edema. So I'm really loving getting to know people on their journey through pregnancy, and we have massage therapists that specialize in pregnancy as well. So there's so many facets to make up a really holistic picture of supporting someone through their pregnancy journey. And I'm really glad that we get to play a bit of a role in that.
Nice. It's good. I've had a few clients, pregnant ladies, and it's so fun to just see their journey through as well, and
everyone's so
mobile
different.
And exercising. So
awesome.
Totally. Can you define, to kick off, define pre and postnatal? So
natal just meaning birth.
Mm-hmm.
And pre and post, obviously, like before and after. So before and after birth, basically. So through the pregnancy journey and then afterwards, there's different facets and different things we have to consider through each part of the journey. But essentially, I guess that's just what it means, sort of pre and post birth.
And post, is there sort of a set time frame, or is it sort of just newly after?
It depends what kind of issues you're talking about. Usually in just like kind of a normal pregnancy, we allow women to come back to exercise sort of about 6 weeks after. Mm-hmm. But that can be very different. You know, women suffer from all different sorts of things after birth, so they can be still dealing with after effects years after. I have people come to see me 5 years after they've had kids and they've still got problems with their pelvic floor. So we can still be working on those particular issues even years down the track.
Mm-hmm. So like with all, I say most exercise, maybe not all, it's usually quite safe to do throughout pregnancy, and the sort of common practice, I guess, with resistance training or weight training is if you've been training before you're pregnant and you get pregnant, there's no reason you can't continue doing so. usually, you're going to obviously going to tire and get a little bit weaker as you go on. So you don't want to be adding volume, and you've got to watch your intensity and all that as you go on. But there's no reason that you can't continue to exercise. I've had women exercise right up until, girls doing full push-ups, 2 weeks before they're having a baby and that. So with Pilates, is there sort of a cutoff, like if somebody's newly pregnant and they want to start Pilates, is there sort of, the trimester or weeks cutoff that they should be starting or stopping Pilates?
It's an interesting question. It really depends on the quality of Pilates and the structure of the class that you go to. Right. If you've never done Pilates before and you want to start, that is 100% okay. But I would recommend going to a class that is a little more clinical in nature. So we have classes that are much smaller. So we only have, say, like 4 women at a time. And that way we can keep it a lot more personalised and teach them the basics and go through what is going to be right for their body and the stage that they're at. If you're going to a class like that, 100% like that is fine. And like you, have had women right up until the day before they've given birth. And, it's really cool to be a part of that journey, and there's no reason why they can't be exercising. But it's just making sure that they're doing it in a really safe and supported way. I wouldn't sort of jump in and start a Pilates class, say like at your local gym. Like it might not be as kind of tailored to what they're sort of needing, especially if they've never done it before. But yeah, if you're going to something that's a little bit more personalized and smaller in nature, and especially if it's on the equipment, we can really kind of tailor that and have it more individualized for people. So yeah, there's not really, I guess it's tricky to answer your question. There's no specific restriction. Right. You're going to something a bit more personalized, but yeah, I wouldn't start anything brand new unless you're going to something that can be a little bit more tailored specifically for pregnancy.
I like the idea of smaller classes, like something a bit more tailored to you.
It's so important, because women go through, and even just pregnancy, like different women will sort of suffer with different conditions, and some won't suffer at all, and they'll just be able to do pretty much what they were doing before, like the whole time. So it just kind of depends on everyone's
I always say that people say, oh, what's, this, what's the best thing for this? I'm like, depends on you. It depends on the circumstances. Yeah, always.
Yeah.
Depends on the individual. And obviously people have got to, work with their healthcare practitioner or professional, obviously take their advice too, of course. So
yeah, exactly.
Cool. So I feel like if you say Pilates and pregnancy, people just go straight to pelvic floor. So what are some of the other areas that women should focus on and address throughout their pregnancy so that they have the best possible pregnancy and birth? I know for myself, I always try and focus a lot on the posterior chain, for carrying that little extra weight at the front, and obviously carrying the baby, once it's born, and, pushing it around, lifting, all that type of stuff. So, what are some of the other areas? Not so much the pelvic floor.
Yeah. There's so many.
Right, everywhere. Strengthening.
Posterior chain, 100%. Like you've hit the nail on the head there. That's a really good thing to be focusing on. The alignment of the pelvis is something that we can really hone in on as well. And I love that because so many women come in and they are sort of misaligned with the pelvis or don't have a lot of awareness around that. And we can really help with that as well and balance that. A lot of women suffer from either lower back pain or like SIJ, like sacroiliac joint pain, symphysis pubis pain, like at the front, in the middle. So any of that kind of discomfort or misalignment or pain, we can sort of help with that as well. And also just another thing, as well as the alignment of the spine and the hips, is kind of just the mindfulness and the breathing techniques and getting yourself ready for that, because it's amazing how many women we're so busy and looking after other people other than ourselves, and it's kind of like rush, 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 go, go, go. And pregnancy is a really beautiful time to just start going inwards and starting to slow down and prepare your body for what's ahead. So I think it's a really nice time to incorporate some of those mindfulness techniques and the breathing techniques and really just increase your body awareness so that you can be a little more in tune and feel when something's not quite right or when something feels good and you want to be doing more of that. So yeah, that's some of the other things other than pelvic floor. Pelvic floor is included, but it's
So usually, you know, particularly women are going to be misaligned in their hips anyway before they even get pregnant. So that just sort of makes it worse, I guess, doesn't it? So in the lower back pain and all that. So clients.
If there's someone that kind of gets a bit of lower back or a bit of like sacral kind of discomfort anyway, it's like pregnancy is just like it's just like that stuff to fight.
Right. I think it was, I don't know, I was going to say something else. Anyway, so yes, what are some of the more common issues you see with women postpartum, so after?
Yeah. Postpartum, pelvic floor is a big issue a lot of the time, and incontinence, that kind of thing. I would say the transverse abdominals are a massive issue, depending on how well women have trained beforehand. If they haven't done a lot of exercise or don't have a lot of awareness around their core, then transverse abdominals can be a really big issue and kind of difficult to retrain sometimes. We also notice a lot of loss through the inner thighs, like inner thigh engagement, along with the pelvic floor. Is really interesting to see how that deteriorates. And just the posture as well. So not just the lower back, a lot of women do complain about lower back pain, but also we have to consider all the feeding, whether it's breastfeeding or bottle feeding, and the sustained postures, and normally the neck through the thoracic, the pecs become really tight, shoulders can become rounded, like having that nursing kind of posture. So those are things we like to sort of focus on as well, because a lot of women come in and they're very stiff, tight and sore.
Right. And just trying to open up through the front as well. It's sort of strength.
Exactly.
Yeah, wow, that's interesting. Yeah. So with the pelvic floor, some people suffer more than others, of course, like with everything. You know, I've got some women that can't skip or, you know, do jump squats or anything without, you know, having to have that feeling of wanting to pee. And then I've got women, you know, I work with mostly mums, and, you know, they're perfectly fine with whatever I give them. So, yes, it does depend on the person, of course, but is it just a case of, not just a case, but is it the main concern is a weak pelvic floor? Is there other issues that tie into it? And what can women do throughout their pregnancy? I know that's a big question and it's probably not a great one. You know, we're better off probably on the floor demonstrating, but anyway, here we are. But what is something that women can do throughout the pregnancy to help their pelvic floor and also even after birth?
Okay. It is kind of difficult to demonstrate or to talk about without demonstrating, but that's okay. I'll do my best. So pelvic floor, normally, like, I guess the issues are like a weakened pelvic floor. The pelvic floor, you know, undergoes so much pressure and stress during pregnancy. But something, and Pilates is a bit of a culprit for it too, is, you know, we used to, when we started going through all these women's health issues and post-pregnancy and started getting education around what's good for our bodies, and there was a lot of push around strengthening pelvic floor. So like doing Kegel exercises and strengthen and hold. And there's a bit of an issue now around over-strengthening the pelvic floor as well. So where we focus so strongly on tightening all the muscles that we don't actually release them enough either. And that can cause a really big problem as well. And it can present similarly to what a weakened pelvic floor can feel like too. So it's really important to train the pelvic floor both ways, to lift and support, but also to have a controlled release as well. So when we're doing exercises like just the pelvic floor kind of lifts, when you can, most women know kind of how to do those ones, the Kegel exercises, like when you lift and hold, it's really important to focus on a controlled release as well. So to feel that lift and hold for like 5 seconds if you can hold it, and then to slowly and controlled release it too. And then there's like the fast little bursts that you can do, like lift and then release and then lift and then release. So there's work with different paces with your pelvic floor exercises. Some other ones we like to do, it's tricky, like squats and that become difficult, and it's better to do, if you're going to be doing squats and those kinds of exercises, it's better to do them with a narrow gait and to do them shallow. Big wide squats is not so good for the pelvic floor, puts a lot of strain on there. And anything like kind of jumping or quick, like women will say they feel like they want to weigh themselves, or they do kind of weigh themselves a little bit, and not so good for the pelvic floor. So we just try and modify those a little bit, maybe like a ball behind the back, so that you're leaning against the wall with your squats, or kind of like leaning against the wall for your, like a held squat. Bridging is a really beautiful, gentle exercise that works for most women. It's just not one that you can really do so much towards like the end of second trimester onwards, because you're obviously not going to be laying on your back. Right. So for post-natal, that's a really nice one to get back into as well, for pelvic floor, for transverse abdominals, and for the glutes, that posterior kind of work as well. Yeah. Those are my faves.
Right. And I mean, you could probably talk about it all day, but how often do you recommend women do those types of exercises, or even Pilates or anything throughout their pregnancy? How often throughout the week do you suggest?
Throughout pregnancy, I would say 3 times a week. The pelvic floor stuff can be done daily to every second daily, as long as I just I like to engage the pelvic floor and to do some of those exercises, but I'm just cautious without telling people to go too crazy on it because of that problem with strengthening it so much. But I think if you're mindful and you're doing it at that pace and you're kind of having the release as well, then that's totally fine. Doing those daily is okay. It's good people talk about doing it when they wash their hands or when they go to the toilet, like just as little triggers to try and remember. Right. But yeah, I imagine even as you're watching this, like I know I'm sitting here right now doing it, because as soon as you start talking,
a little bit,
yeah, you can't help it.
I get my girls to do stuff like that, like if they check the time or something, to engage their core or whatever, just to get into a habit, or sit up straight, shoulders pulled back or whatever, just to get the habit of thinking about it more often throughout their day, instead of just rocking up to the session and going, okay, Alison, you think for me, but the more that they can think about that throughout the day, the better off. So yeah, cool.
Exactly. Yeah, it's so true. It's
good. So I feel like the lower abs they cop it a little bit more. I mean, I know you mentioned the transverse is a big deal, of course. Sort of your deep core muscles there. But I feel like the lower abs cop it a little bit, especially if there's multiple bursts. They tend to weaken. Is there anything that women should focus on, or are you thinking just the whole transverse abs there? But yeah, they should focus on and again, this one's probably better demonstrated on the gym floor or Pilates mat, but here we are. But yeah, is there anything that they should focus on particularly that could help strengthen that area?
Yeah, I would go transverse. It's that ties in with the pelvic floor as well, so that's going to be dually effective. And it gets tricky, because working postnatal, if we go to focus on the rectus abdominals too much, even if we're trying to target the lower end, a lot of the exercises could be contraindicated, depending if people have had abdominal separation or anything like that. So I tend to look at the transverse abdominals and get people to put their fingers kind of like to the inside of their hip bones and start to feel where those muscles are, like sort of start to retrain. And then we do things like the pelvic rocks, so like pressing the lumbar into the floor and then back again, so like rocking the pelvis forward and back. And then things like dead bugs, where you're laying on your back and you're lifting one leg up off the floor at a time. Not having both legs elevated, but just kind of one at a time to get that pelvic stability and start to work through the TA. Bridging again is a good one, and I like working quadruped as well. So like on hands and knees, and placing like one leg, like lengthening one leg out behind you. Cool. If you want to incorporate the glutes, you can start to lift that leg as well. So all of that stuff's nice and gentle on the abdominals, and yet still gentle in the terms of like if they've had separation, but enough that they're starting to engage those muscles again to retrain. Cool. So I think there's some really, I wish, sorry, I can't demonstrate.
Yeah, I know, right? I know, it would be perfect. I was even when I was sort of thinking about this, like, how do we do this? But I understand that. I appreciate that. I might even, put some, links to some of those exercises or demonstrate them or whatever anyway. So, yeah.
Yeah, that'd be great.
Yeah. I had a friend she had a bit of separation and she was doing sit-ups. I didn't know this, she didn't tell me, but she was doing sit-ups for like a year or two after, and then I think she was doing a yoga class or Pilates or something, and somebody pulled her up, and I was like, don't do sit-ups, it's probably the one thing, but people are so quick to do sit-ups and crunches to get their abs back, but it's probably one of the worst things you can do, actually.
Unfortunately, it's a shocker. And I can see why people do it 100%, but I guess it's just the education isn't out there that is like, increasing that intra-abdominal pressure is just like...
more harm than good, And sit-ups aren't even an effective exercise anyway, but that's a whole nother thing. But anyway, people are still... Anyway. Cool. I think that's it for those. Yeah. Mm-hmm. But can you tell us a bit about this lymphedema? Is it, you're a lymphedema therapist, so what is it and how common is it?
Yeah. So lymphedema itself is a dysfunction of the lymphatic system. Mm-hmm. So you've got primary and secondary lymphedema. Primary lymphedema is when somebody's born with a default, usually born with a default in their lymphatic system, whether it's not enough vessels, not enough nodes, like some kind of interruption there. Mm-hmm. And it will result in the swelling of a body part. Could be legs, could be arms, could be face. It can occur kind of in any region. Right. The secondary lymphedema that I see mostly is working with women, and particularly post-breast cancer. But for a lot of cancer treatments, they remove lymph nodes. So that's enough to disrupt the system, and people result with lymphedema. Lymphedema occurs probably in about like 20% of women post-breast cancer. So that's the highest kind of population that I see. But with the principles for handling lymphedema is very similar to working with the principles of edema, so just normal kind of swelling. Right. And that occurs in most women during pregnancy. You're pretty lucky to escape if you don't get swelling during pregnancy. Some point, right. Like the body's producing 50% more fluid and blood. So, and not only that, but you've got this big, beautiful belly that's pressing down on some of the circulation that's stopping the fluid getting back up into your main system. Right. So particularly for women who have to sit a lot during pregnancy, if they're still at work and they're sitting, their feet and ankles and legs can get quite swollen. So, it's important to be mindful if the swelling is painful or if it's worse in one leg than the other, because you can get things like blood clots and stuff like that too that women need to be mindful of. Yeah. But if it's not painful and it's just like kind of swelling in the feet and ankles and legs, or sometimes even in the hands as well, then that's something we can kind of do something about with some massage, potentially compression, things like that. There is some techniques that are quite effective, and women just kind of suffer through it a lot of the time, but it's normal and just,
I guess it's normal, but there is stuff that you can do.
Yeah, absolutely. I hate that word normal. Like, it's common, but like
common. Yeah, common's a better word. You're right. Yeah. Common. Normal's not.
But I think a lot of women get told that, it's normal, don't worry about it. It's like, well, actually, it's really uncomfortable, and there's stuff we can do about it. So,
and there's things that can be done to help.
Yeah, exactly. So I originally started lymphedema working mostly with cancer patients, but it's been really nice to stepping into the private world, working so much more with pregnant women. It's become, I just didn't realize how much of a need there was for it. And yeah, it's a really nice part of my services now. I really love it.
And the results, are they, like, it would be obviously ongoing throughout their whole pregnancy?
Yeah, it's better to get onto it early as well. But there's also techniques and stuff that we give women to do themselves, because the nature of the lymphatic system is that it doesn't have its own pump. It's not kind of pumped by your heart. So it kind of needs constant movement, massage to keep it flowing. So there's different techniques that we give women to help manage it themselves as well. And then when they need a bit of a top up or need a bit of help, then they come in for a massage and we kind of, do the rest.
Yeah, cool. Good.
Yeah.
I really like, before you're talking about mindfulness and stuff, and all the other women that I've had on with different subjects about nutrition and thyroid and mindset and all that, and everyone's sort of coming back to mindfulness. So it's great that you even said that as well. So I hope that everybody watching these are catching on that there's a common theme here, that it all comes down to mindfulness. And so yeah, I really enjoyed that. So is there anything else that women should know right now off the top of your head, or we covered most things?
Oh God, I don't know. I think the important thing is to just listen to your body, because like all the women that I see, their journeys are so different. And I've got women who want to lay on their back right up until their due date, because that's the way they're most comfortable and they have absolutely no dramas. Others that can't lay on their back from very, very early because they don't feel well and they get dizzy. So it's not even just that, but just, being able to tune in and pay attention to your body and to sort of trust yourself, I think is really important, and not comparing to what other people are doing, because everyone's journey is just so different. And to ask questions and just inform yourself as much as possible, I think is really important as well.
Cool. Good. So how can people get in contact with you, or if they want to work with you or find you online? What's the best way?
Yeah, so we're on Facebook and Instagram under Recover Wellbeing. We've got a studio in Currumbin on Thrower Drive. And we've also now got an online community. So I realised, especially for our new mums, that it was really hard to get back into the studio. So we've created an online community that has videos, recipes, tutorials, all that kind of stuff.
Amazing.
So and I've given you a link, Alison, so you can share with your and they get a 30-day free trial just to check it out, see if they like it. There's some workouts on there specifically for post-pregnancy and diastasis recti and stuff like that. So that's us.
Good. Yeah, I'll attach some of those links, definitely. So thank you so much.
No worries.
Yeah,
Thank
I really
you for
appreciate
having me.
taking the time. Thank you. And I'm sure everybody I learned some things. So not that I'm pregnant or anything, but I definitely learned some things as well. And I can share that onto my clients too. So thank you so much for taking the time out today to do this with me.
You're welcome. Thank you so much.
Thank you. All right, we'll chat soon. Bye.
Sounds good. Bye.